Hello, my name's George. Um, I'm a registered nurse now, psychiatric nurse. Um, but for 30 years, well, something like that, in 1986 anyway, I became a psychiatric technician. And they're also called behavioral health tech, mental health worker, mental health tech. Um, it's a job where you really don't need any education whatsoever. In some places, and you need up to a bachelor's degree in other places. But usually it's um, very little education. They like to see a few college credits, though. So I worked as a psychiatric technician for, I think, 4 years, 5 years, and then I became president of the American Association of Psychiatric Technicians. And I did that for 10 years, ran that association, and we had members. By the end of the 10 years, we had members in every state in the country. Um, Later, I went to paramedic school, became a paramedic on an ambulance, and then I went to nursing school. And during nursing school, I took the LPN test and became an LPN. Like, um, and I did that for about 8 months, and then became a registered nurse after I graduated from nursing school. And I've been in psych the entire my entire career. So what I'd like to do on this channel is talk about some tips to work as a psychiatric technician. Maybe some tips on how to get a job, what the job's all about, um, and some things I've seen psych techs do that are terribly wrong. And when I was president of the American Association of Psychiatric Technicians, I often got phone calls from reporters when a psychiatric technician accidentally killed a patient. And that did happen every once in a while. So um, we're going to talk about ways to avoid hurting patients too, because that's pretty important. Now, how I want to do this, I don't really want to um, talk to you, lecture you like I'm your boss or like I'm a nurse and you're working for me on a unit. I don't want to do it that way. I really want to talk to you as if you're a friend who came over to my house and you're asking me some advice about working with a certain patient, or maybe working with borderline patients, or working with psychotic patients, or uh, various other things. So that's the tact I'm going to take. I don't know how often I'm going to post, maybe every couple of weeks, maybe every week if I can get to it. But I'm looking forward to talking to you, getting to know you in the comments. I answer all my comments. At least I do that now. I can do it because I don't have a whole lot of subscribers. But maybe later on, it won't be so. Who knows? So I'm glad you came by and ask me any questions you want, and I'll talk to you later.